Hey, it's Morgan Wynn, and I did my capstone project over COPD, or chronic obstructive pulmonary disease. So let's get into this PowerPoint. So like I said, COPD is what we commonly call chronic obstructive pulmonary disease. It's just a lot less wordy. So why did I choose COPD? Well, I work in a local ER, and one of the most common diagnoses that we see patients get admitted with is COPD exacerbation. And unfortunately, my dad has a diagnosis of COPD and has to be hospitalized on occasion, and unfortunately has had to be ventilated before. So I see COPD a lot in my personal life and at work constantly, but what exactly is it? Well, COPD is an inflammatory lung disease, and these patients are going to have shortness of breath, excessive sputum, a cough, and wheezing. But why? So let's take a look. These bronchial tubes that these patients have become inflamed, and these bronchial tubes are throughout the lungs, and it's what brings the air in from the outside world in for gas exchange. And when these bronchial tubes get inflamed, they become thicker and constricted. They might create more mucus, and it makes a very narrow airway, so therefore less air comes in. And they also have destroyed alveoli. The alveoli are the tiny air sacs inside the lungs, and they are the site of the gas exchange in the lungs. So right here, this shows a healthy alveoli with all these little tiny air sacs inside of it. But this one down here on the COPD shows that it's more stretched out, more dead. And then here on the histology of the tissues, you see that this one has lots of folds. It's a greater surface area for that gas exchange, and this has a lot less. So where does this inflammation come from? Well, this inflammation comes from inhalants such as cigarette smoke, cooking fumes, dust, and gases. The organism of a COPD patient, they're going to commonly manifest as decreased oxygenation throughout their body. They're going to have decreased circulation. They have a greater chance of heart issues, low energy levels, and it's hard for them to do daily activities. Some common comorbidities in COPD patients are cardiac disease, diabetes, hypertension, osteoporosis, and psychological disorders. And COPD patients have a very high risk of developing harmful pneumonias. So for a COPD patient, let's think about down the road. So life with COPD, most of these patients are going to be put on bronchodilator and steroid medications. Most of those are inhalers. Some of them are PO medications. They might have to be put on supplemental oxygen. And because of the supplemental oxygen, if they have to carry it around constantly, they're going to have self-image issues. They might have depression. And they, like I said, they'll have to be hospitalized commonly when they get exacerbated. COPD comes in stages. 1 is mild all the way to 4, which is very severe. And to improve the COPD patient's life expectancy and health at the time of diagnosis is to stop the irritation to their lungs. So whether they are out and about with other irritants, but most of the time it's by cigarette smoke. So if they stop smoking and reduce the further damage to their lungs, then they're going to have a better outlook and a better projection. And a big thank you to all of these websites and articles that helped me make this and my paper.